It's a sunny Saturday morning, and the park is bustling with activity. The air is filled with the sounds of laughter, chatter, and the rustling of leaves in the gentle breeze. Children are laughing on the playground, their joy infectious as they swing higher and higher, their faces lit up with pure delight. Families are picnicking under the trees, sharing meals and stories, creating memories that will last a lifetime. The aroma of freshly baked bread and homemade dishes wafts through the air. And a group of seniors is practicing Tai Chi in the open space, their movements slow and deliberate, a testament to the harmony between mind and body. A group of volunteers is setting up a booth for a health fair, offering free blood pressure checks and information on healthy eating. They are dedicated to improving the health of their community, one person at a time. At first glance, it's a typical day in the park. People are engaged in various activities, enjoying the beautiful weather and the company of others. But look closer, and you'll see something else at play: the principles of community health psychology in action. This field goes beyond the surface, delving into the deeper connections that bind us all. Community health psychology goes beyond focusing on individual health. It seeks to understand the collective well-being of entire communities, recognizing that our health is intertwined with the environments we inhabit. It looks at the health of entire communities, understanding that the well-being of individuals is deeply interconnected with the environments they live in. The neighborhood, the social networks, and the local resources all play a part in shaping our health. This approach recognizes that factors like access to healthcare, social support, and economic opportunities play a crucial role in shaping health outcomes. It's about creating an environment where everyone has the chance to thrive. This vibrant park scene is not just a coincidence. It's a carefully cultivated space designed to enhance the well-being of the community. It's the result of community health psychologists working behind the scenes, collaborating with local organizations and residents to create a space that promotes well-being. They engage with the community, listen to their needs, and develop strategies that address those needs. They understand that parks are not just recreational spaces, they're vital community assets that foster social connections, encourage physical activity, and improve mental health. These spaces are designed to bring people together, to create a sense of belonging and support. By taking a community-level approach, community health psychologists aim to create sustainable and equitable health outcomes for all. They work to ensure that everyone, regardless of their background, has access to the resources they need to live a healthy life. They recognize that health is not merely the absence of disease, but a state of complete physical, mental, and social well-being, influenced by a complex interplay of individual, social, and environmental factors. It's about creating a community where everyone can flourish, where health and happiness are within reach for all. Community health psychology is a field that emphasizes the connection between individuals and their communities. It delves into how our surroundings, social networks, and community structures influence our overall health and well-being. It recognizes that our health is not solely determined by our genes or personal choices. Instead, it acknowledges the profound impact of our social interactions, economic status, and the environment we inhabit. Instead, it's significantly shaped by the social, economic, and environmental conditions of the places where we live, work, and play. These factors can either enhance our health or contribute to health disparities. Traditional models of health often focus on treating illness after it occurs. This reactive approach, while necessary, often overlooks the importance of prevention and the broader context of health. In contrast, community health psychology emphasizes prevention and early intervention. It aims to identify potential health issues before they become severe and to implement strategies that promote long-term health. It seeks to address the root causes of health disparities by working to create healthier environments and empower communities to take charge of their well-being. This involves a collaborative effort where community members actively participate in health-promoting activities. Imagine a community struggling with high rates of obesity. The approach here would be multifaceted, considering various elements that contribute to this issue. A community health psychologist wouldn't just focus on individual weight loss programs. They would look at the bigger picture, understanding that individual behavior is influenced by broader social and environmental factors. They would also investigate factors like access to affordable, healthy food options, ensuring that nutritious choices are available and accessible to everyone in the community. The availability of safe spaces for physical activity, such as parks and recreational areas where people can exercise without fear. And the cultural norms around food and exercise within that community. Understanding these norms helps in designing interventions that are culturally sensitive and more likely to be accepted by the community. By understanding these broader influences, community health psychologists can develop targeted interventions that address the underlying causes of health issues. These interventions are more effective because they are tailored to the specific needs and circumstances of the community. This might involve advocating for policy changes, such as implementing regulations that promote healthier food options in schools and workplaces, partnering with local organizations to improve access to resources such as healthcare services, nutritional counseling, and fitness programs, or developing culturally tailored health education programs. These programs can educate community members about healthy lifestyle choices in a way that resonates with their cultural values and practices. By fostering a supportive environment, community health psychology aims to create lasting positive changes in public health. Community health psychologists work in a variety of settings, reflecting the diverse nature of their work. Their roles are multifaceted and can adapt to the needs of the community they serve. You might find them in hospitals and clinics, where they collaborate with medical professionals to provide holistic care that addresses both physical and mental health. But their reach extends far beyond traditional healthcare settings. They are also found in community centers, schools, government agencies, and nonprofit organizations, each offering unique opportunities to impact public health. Their presence in schools is crucial for promoting healthy behaviors early on. By integrating health education into the curriculum, they help shape the habits and attitudes of young people. They might develop programs to prevent bullying, address substance abuse, and create a safer, more supportive school environment. Promoting mental health awareness among students is another key focus. They work to reduce stigma and provide resources for those struggling with mental health issues. In government agencies, they might contribute to policy development, ensuring that public health considerations are integrated into legislative decisions. This includes advocating for health equity in urban planning, transportation, and housing policies, which can have a profound impact on community well-being. Community health psychologists also often work with nonprofit organizations, focusing on specific health issues or populations. Their expertise helps these organizations design and implement effective health programs. For example, they might work with organizations dedicated to cancer prevention, HIV/AIDS awareness, or other critical health issues. They play a vital role in community outreach, improving access to healthcare for underserved communities and raising awareness about important health topics. Their work is often collaborative, involving partnerships with community members, healthcare providers, policymakers, and other stakeholders. This collaborative approach ensures that interventions are well-rounded and effective. The key is to meet communities where they are, understanding their unique needs and strengths. This requires a deep commitment to listening and learning from the community. By conducting thorough assessments, they can identify the strengths and challenges within a community, tailoring their interventions accordingly. This approach ensures that interventions are culturally relevant, sustainable, and respectful of the community's values and traditions. Ultimately, the goal is to create effective health programs that address the specific challenges faced by different communities, fostering a healthier, more equitable society for all.